Hello, sir. Good morning. My name is Dr. Saha, one of the PACES candidate here today. Sir, I've been asked to examine your lungs and chest. Sir, what I'm going to do, I'd like to have a very good look first, feel, tapping, and listen to your chest. So, do you have any pain right at this moment at your chest?
No.
All right. So, during this procedure, if you feel any kinds of pain and discomfort, just let me know. I'll stop at that moment. Is it all right?
Right.
All right. Thank you very much. Yes, my dear doctor. Station 1, respiratory system. The examination skills and approach that we are learning here with these lectures, my dear. My dear, listen very carefully. Before entering the room, that you need to prepare yourself how to deal the station 1 respiratory system. You will have the station 1 abdomen first case, and the second case will be the respiratory system. So you need to prepare yourself before entering the room and thinking the approach and rehearse them before entering the room. Yes, my dear doctor, you need to know them, the steps that you need to learn. The first thing, my dear, listen very carefully, the important steps of the respiratory system, that while you're presenting your case, that you need to keep in your mind all the features and all the steps all together, and all the important points. So yes, my dear doctor, the points are, the first important point is chronic lung disease, the most commonly encountered in PACES exam. The chronic lung disease is evidenced by the C4 cyanosis. Just keep in your mind the important points. What I say, the chronic lung disease, C4 cyanosis. Second important point is really important, that the type and the variety of the lung disease, chronic lung disease, but this variety of lung disease, that will be answered by the clubbing. So once again, chronic lung disease, cyanosis, type of lung disease, clubbing. And third important point, that this variety of the lung disease or specific lung disease is complicated by respiratory failure. And especially we need to look for the carbon dioxide retention findings. So once again, what I said, chronic lung disease, clubbing. Second important points, there is the type of lung disease, the chronic lung disease, cyanosis, type of lung disease, clubbing. And the lung disease is complicated by the respiratory failure with the carbon dioxide retention. And fourth important point, the core pulmonary is complicated by the core pulmonary, means the heart failure, means the right heart failure, the features. And fifth important point, whether this gentleman is on steroid, means the corticosteroids. And yes, my dear, this is very important. And the next important point, the underlying etiology of the specific chronic lung disease. So once again, chronic lung disease, cyanosis, type of lung disease, clubbing, respiratory failure, carbon dioxide retention, heart failure, core pulmonary, and the corticosteroid evidence, and last is the etiology. So these are the 6 important points that you need to cover. And you need to keep in your mind, and you need to rehearse them many, many times before thinking and also before presenting your case, my dear. So once again, let me start with the first important point. There is a chronic lung disease, the cyanosis. Yes, my dear doctor, you entered in the room, that you have seen the tips of the fingers and the tips of the toes and tips of the tongue and the earlobes. They're having the bluish discoloration. So you can diagnose the cyanosis. So the cyanosis means the chronic lung disease. And the chronic lung disease is also evidenced by, means these are caused by the chronic bronchial asthma, chronic obstructive pulmonary disease, means the COPD. And next is the bronchiectasis as well as the pulmonary fibrosis. So the chronic bronchial asthma usually not given in the station 1 respiratory system. So the cases are for the chronic lung disease that you need to remember. There is the chronic obstructive pulmonary disease, means the COPD, bronchiectasis, and pulmonary fibrosis. So these are the 3 important cases that are usually given. So what I said, COPD, bronchiectasis, and pulmonary fibrosis. So yes, what I said, the first important point, as I said, the chronic lung disease as evidenced by cyanosis. So we found the cyanosis So we can think about, yes, this chronic lung disease is present. Cyanosis. Immediately after that, the type of the lung disease will be divided by the clubbing, the presence of clubbing. So once again, my dear, listen very carefully. The clubbing in respiratory system means in station 1. What are the causes of clubbing? So let me start with the clubbing. So the clubbing, the rule of C, once again, the C for the first disease, my dear, CFA, then the CF, and then the cancer. Yes. So what I say, the CFA means the cryptogenic fibrosing alveolitis. And the C for cryptogenic fibrosing alveolitis means the idiopathic pulmonary fibrosis. And next, C for the cystic fibrosis. Yes, my dear doctor, and C for the cancer means the lung cancer. So the C for, once again, CFA, CF, and cancer. So yes, my dear doctor, you need to know the CFA means the cryptogenic fibrosing alveolitis / means the idiopathic pulmonary fibrosis, or the classification means the typical type of the cryptogenic fibrosing alveolitis, the UIP means the usual interstitial pneumonia. And second is the cystic fibrosis, the most common cause of bronchiectasis, United Kingdom. And bronchiectasis is one of the important cause of suppurative lung disease. So all the suppurative lung disease can produce clubbing. So once again, CF equal to bronchiectasis equal to suppurative lung disease. So once again, suppurative lung disease caused by A, B, C, D, E. So yes, my dear, A for, that we need to remember, abscess, B for bronchiectasis, C for cystic fibrosis, D for delete, nothing is there, and E for empyema. So once again, the A, B, C, D, E are the suppurative lung disease causing clubbing. And last but not the least, C for cancer means the lung cancer. And also the other variety of cancer like the mesothelioma can produce the clubbing. And the cancer, lung cancer, especially the non-small cell lung cancer, especially the squamous cell lung cancer producing the clubbing. And mesothelioma. And also that we need to remember asbestosis causing the lung fibrosis, pulmonary fibrosis also can cause the clubbing. So yes, we have got the causes of clubbing in respiratory system. So once again, the clubbing will give you the idea. So the CFA, CF, and last the lung cancer. So it's because that the chronic lung disease, the first important point as evidenced by the cyanosis, if the cyanosis is present, so the diagnosis, COPD, bronchiectasis, pulmonary fibrosis. If the cyanosis is not present, so other than these diseases. And second cause, second step, the second important point, there is a type of lung disease, there is the presence of clubbing. So the clubbing is caused by at least these three important things that we need to remember. The CFA, CF means the bronchiectasis, and also the C4, the cancer, the lung cancer. So if the clubbing is present, so the diagnosis is CFA, and maybe the asbestosis, pulmonary fibrosis, and second is the CF means the bronchiectasis caused by whatever the cause is. But yes, the cystic fibrosis will produce the clubbing. So the clubbing presence means the diagnosis, cryptogenic fibrosing alveolitis, asbestosis, means the pulmonary fibrosis, these are the causes, and also the cystic fibrosis means the bronchiectasis, not the COPD, so that we can classify whether the clubbing is present and clubbing is absent. So what I said by the first important point, that the chronic lung disease, the cyanosis, COPD, bronchiectasis, pulmonary fibrosis, and second important point, that is the type of lung disease, the presence of clubbing. And clubbing means CFA, CF, and cancer. Means the CFA and CF. That's it. And third important point, my dear, this chronic lung disease is complicated by respiratory failure. And respiratory failure is evidenced by especially the carbon dioxide retention. And carbon dioxide retention findings, the bundle packs, are the pulmonary edema, warm sweaty hands or warm hands, bounding pulses, and the flaps. So these are the four important points that we need to remember for the carbon dioxide retention. So we need to look for specifically whether these carbon dioxide retention findings means the type 2 respiratory failure is present or not. And fourth important point, there is a core pulmonary, means this chronic lung disease complicated by core pulmonary. There is evidence by right heart failure. The features of R for H and F means that you can remember R for H JBP, and H for hepatomegaly, tender pulsatile hepatomegaly, and F for foot edema. So at the bedside, then we need to look for all the foot edema. That's it. You are not allowed to examine the cardiovascular system and the abdomen as well, so you are not allowed to do so. So you need to look for only the leg edema that will give you the idea, the diagnosis of the core pulmonary. So yes, the core pulmonary means the leg edema. And the fifth important point, there is this gentleman is on steroid or not. Then we need to look for corticosteroids. So corticosteroids evidences are skin thinning, easy bruising, steroid purpura, Cushingoid fasces, and with the steroid card at the bedside, or medical or breastfed as well. So these are the 4-5 important things that we need to look for the steroid evidences at the bedside, with the corticosteroid evidences. And the last but not the least, the 6 important points, there is an underlying etiologies. Yes, my dear doctor, the underlying etiology is really important. Underlying etiology that we need to look for, and we'll discuss further with the specific etiology what we are looking for. And last but not the least, that the 7 important point that I can add here, there is any evidences that this gentleman or the patient is on any treatments at the bedside surroundings. The bedside surroundings is really important. That can give us the treatment evidences, as because sometimes we are getting the inhalers, and the different types of inhalers that you need to look for, whether this is the salbutamol inhalers, salmeterol inhalers, means the bronchodilators, or maybe the steroid inhalers, means the preventer. And then we need to look for any nebulizers at the bedside. And then we should think about any oxygen cylinder at the bedside. And also we need to look for any peak flow meter at the bedside. And we need to look for any sputum port at the bedside. And mostly, sometimes, the walking aids at the bedside, the respiratory system, so that you can think about the patient is really unable to walk because of the breathlessness. So we can assess the severity of respiratory distress. So these are the bedside surroundings at the last important point, the 7 important point. It may be seen at the initial point or it may be seen in the later on. So yes, my dear doctor, these are the 7 important points. Putting all them together, you need to keep in your mind. You need to see and you need to get them in your hands so that you can present your case to the examiners. So summarizing all them together, all the C's bundle pack that we can see, C, the rule of C. Rule of C starts in the chronic lung disease as evidenced by C for cyanosis. Second important point, the type of lung disease, the C for clubbing. And third important point, the evidence of carbon dioxide retention, means the respiratory failure, carbon dioxide retention, bundle packs. And fourth important point, the core pulmonary, the C for core pulmonary, evidenced by the leg edema. And fifth important point, the corticosteroid evidences. And sixth important point, the etiology. And last but not the least, the treatment at the bedside surroundings. So these are the 7 important points. So rehashing them, quick recap once again. C, chronic lung disease, cyanosis. Type of lung disease, clubbing, C for clubbing. And then the core carbon dioxide retention, then the core pulmonary, then the corticosteroid evidences, and then the treatment options, means the bedside surroundings. So these are the 7 important points that we need to know idea, so that you can rehearse them and you can present your case to the examiners. Yes, my dear doctor, keeping them the 7 important points in your mind, that you need to rehearse the important steps, that we call it the approach, so that we can reach the diagnosis all together, and all the findings keep in our hands, put together, make our diagnosis. Yes, my dear doctor, the approaches of the respiratory system that we need to learn. The stepwise fashion manner, if you know them, and if you just approach, and if you just follow them, we can be able to make the diagnosis within a very short time, just entering the room, just doing some of the important steps, get the diagnosis in your hands. So that is the best step that you are learning now, my dear. So let's do it. The steps that you need to remember, my dear. Respiratory system approach. The approach starts with the chest expansion, my dear. Means that I call it the symmetry. With the chest expansion, the symmetrical chest expansion. So the first step is the symmetry of the chest expansion. If you found the symmetry, then you will go for the AP diameter, which is increased or not, or decreased. So the second step is the AP diameter. If the AP diameter is increased, so yes, then you next to the step, you need to think about your crackles. So what I said, just say with me, symmetry, AP diameter, crackles. So yes, my dear doctor, if you found the symmetrical chest expansion reduced, definitely the patient is given to your exam. Diseased patient, diseased lung, so definitely the chest expansion reduced. Keep in your mind the important points, my dear. So once again, what I say, the chest expansion symmetry. So symmetry, if you found the symmetrical chest expansion, so the disease should be the diffuse disease, diffuse lung disease. So yes, my dear, the symmetry, if you found the diagnosis, the COPD, bronchiectasis, pulmonary fibrosis. So what I said, symmetry equal to COPD, bronchiectasis, pulmonary fibrosis. And if you come back to here and see the AP diameter is increased, so the diagnosis, COPD and bronchiectasis. And now then you need the stethoscope to put the stethoscope onto the lungs to get the crackles. If you found the crackles, diagnosis bronchiectasis. If the crackles absent, diagnosis COPD. So that is the way that we need to learn, my dear. I will show how to do that, the approaches. If you don't found the symmetry, the next step is the asymmetry, means you found the right chest moves but not the left. So the left-sided pathology is there. So if you found the asymmetry, the next point is the scar. Means if you found the scar over the left side, there's a lobectomy and pneumonectomy. So the scar, the diagnosis, lobectomy and pneumonectomy. So how to differentiate between these two? Just to put the hands for the diagnosis for the tracheal position. If the trachea is shifted, diagnosis pneumonectomy. If not, there's a lobectomy. So what I say, the asymmetry, scar, trachea. So once again, asymmetry, scar, trachea, asymmetry, scar, trachea. So beforehand, symmetry, epidiameter crackles, symmetry, epidiameter crackles, asymmetry, scar, trachea. Now that we found the asymmetry, but scar absent, no scar. So definitely pathology on the left side, but no scar. So asymmetry, no scar. The next point is a Dallon percussion. Basal, yes, the Dallon percussion of the lung base. So Dallon percussion, lung base, the diagnoses are pleural effusion, pleural thickening, consolidation, collapse, and cancer. So what I said, the Dallon percussion, the lung base, pleural effusion, pleural thickening, pleural effusion, pleural thickening, CCC, yes, the consolidation, collapse, and cancer. So that's the end of the approach, my dear. So what is the approach? We learned the approach starting from the symmetry, epidiameter crackles. Say with me, symmetry, epidiameter crackles. And second one, asymmetry, scar, trachea, asymmetry, scar, trachea. And third, asymmetry with no scar, Dallon percussion. Yes, my dear. So once again, symmetry, epidiameter crackles, symmetry, epidiameter crackles, asymmetry, scar, trachea, asymmetry, scar, trachea. And next one, asymmetry with no scar, Dallon percussion. Symmetry, epidiameter crackles, asymmetry, scar. Then the trachea, asymmetry, scar, trachea. And next, asymmetry with no scar, Dallon percussion. So please rehearse them and just go with them many times, man, the way that I'm saying. So once again, symmetry, epidiameter crackles, asymmetry. Once again, scar, trachea, asymmetry, scar, trachea. And next one, asymmetry with no scar, Dallon percussion. So now rehearsing once again the symmetry diagnosis, COPD, bronchiectasis, pulmonary fibrosis. Epidiameter is increased, diagnosis COPD, bronchiectasis, and not increased, diagnosis pulmonary fibrosis. Now the crackles, if the crackles found, bronchiectasis, crackles absent, COPD. Now you found the asymmetry. You found the scar, means the diagnosis pneumonectomy, lobectomy. Next the trachea is shifted, pneumonectomy, trachea not shifted, lobectomy. Now the diagnosis. Next one, the asymmetry, no scar. Next step is the Dahlman percussion. The Dahlman percussion diagnosis, pleural effusion, pleural thickening, consolidation, collapse, and cancer. And for the pleural effusion, pleural thickening, pleural effusion done, stony Dahlman percussion, done diagnosis. Pleural thickening cases are not given nowadays. Consolidation, yes, this case is not given, but just keep in your mind, the consolidation means the solid organ. So the CEP and BSBR means the chest expansion. PN for the percussion note, BS for breath sound, and vocal resonance means the BSBR. These are the 4 important points that you need to include in your exam smile. You must do that. You shouldn't miss them. So CEP and BSBR, all the things, all the components will be increased in a consolidation. The solid structure, as I said, this consolidation cases is not given to your exam. So once again, the pleural effusion, the stony Dahl, pleural thickening cut is not given. And next is the consolidation, the infectious case is not given. And next is the collapse and the malignancy. Here's the collapse, the trachea shifted, the single one. And C for cancer, the mass lesion. Then you'll get the Dahlman percussion, of course. And also the breath sound, vocal resonance, every sounds will be reduced. So yes, very simple. The simplest approach, my dear, we learn symmetry, epidiameter, crackles, asymmetry, scar, trachea, asymmetry with no scar, Dahl. So these are the 3 important things and the flowcharts that we learned, the approach, the best approach, the simplest approach to reach the diagnosis, my dear. You rehearse them, do practice them many, many times, and you'll get the diagnosis in your hands, and we'll see in the different cases, my dear, later on, in the different cases, different video clips, different video lectures altogether, we'll see that how this approach is really important to pick up the important signs, put together and make our diagnosis. Yes, my dear doctor, now you will learn and you'll see that how the examination skills and how the examination should be done, keeping in your mind with the approaches that we learned, that the symmetry, epidiameter, crackles, asymmetry, scar, trachea, asymmetry with no scar, Dahl. So yes, my dear doctor, immediately enter in the room that you have done the Jeep bundle packs that you need to do, my dear. The Jeep starts with the G for good greetings, introduction, instruction, position, pain, position, and poser. So what I say, the Jeep bundle pack should be done. So here's the greetings, introduction, instruction. Yes, my dear, pain, position, and poser, 6 important points. So enter into the room that you say the good morning, good afternoon, sir, and with a good smiling, my dear, is really important. And wash, in the meantime, you wash your hands with the G for gel. Wash your hands, gel, hand gel. So the good greetings, good smile, gel, all together. And along with the handshake. Immediately after that. So yes, this is called the greetings bundle pack, my dear. And then I for introduction, introduce yourself. And during introduction, you just handshake. And then introduce yourself. My name is Dr. Shah, one of the PACES candidate here today. And then instruction. During instruction that you just look at there, what is written there? It's written there, station 1, respiratory system, examine this gentleman's respiratory system. Sometimes these clues, sometimes maybe there may be a clue. So clue is important, my dear. Sometimes there may be clue. Maybe the history of diarrhea or something. So history of diarrhea that you need to examine the patient. So the GIT involvement in the respiratory system, GIT plus respiratory. So yes, my dear, chronic GIT, chronic respiratory infection or chronic respiratory involvement is the bronchiectasis and chronic GIT problems. The diagnosis, the 2 important diagnoses you need to remember, means the cystic fibrosis, first one, and second one, the hypogammaglobulinemia. So means, my dear, what I'm saying, the instruction is important to look at that. And you will see in the different cases how this is really important. Immediately after the instruction that you need to tell to your patient, sir, I have been asked to examine your chest. And what I'm going to do, I'd like to have a very good look, means inspection, and have a feel, means the palpation. And then tapping means the percussion, and listening means the auscultation. So yes, what I'm going to do, I'd like to have a very good look, feel, tapping, and listen to your chest. And next is the position, my dear, is really for pain, position, and posture. And during this procedure, if you feel any kinds of pain and discomfort, just let me know. I'll stop at that moment. And you can ask him, is there any pain right at this moment at your chest? So he said, no. So immediately after the pain, that the position, my dear, for the respiratory system examination, that you need to keep the patient's head end for the 45-degree angle. If it is 45-degree angle set up, so you can start the examination. But you need to do that, this lying flat. So 45-degree angle is needed because doing this one, making the lungs to come forward towards the skin so that you can get the findings. So 45-degree angle. So you need to tell to the examiner, so I need to make the head and to make it 45-degree angle. So immediately after the positioning, yes, you need to expose him. So you need to tell him, sir, would you mind just put off your shirt? So yes. So you can help him. So it will be really helpful if you just help him. Yes. You can sit forward, just put off your shirt fully. Yes, sir. So helping him means that a positive approach that you are having, my dear. So lie back for me, sir. And always keep the patient in a comfortable state. You need to tell him, sir, are you comfortable? Yes. All right. Thank you very much, sir. So yes, my dear doctor, the examination skills means the examination starts from the foot end first. Yes, my dear. So let's start with the foot end. Yes, I need to go there. I need to tell him, sir, could you please turn your head on the left side for me and take a deep breath in and out for me. Once again. So I'm looking here, the chest expansion with the symmetry. Once again. So I think that I found that the symmetry of the chest expansion. Okay, sir. Thank you. Next step that you need to tell him, turn your head on the left side. Sir, give a cuff for me. Yes. So from the distant end that we are looking for the chest expansion and tell him to give cuff for me. So the cuff, if it is productive, so the diagnosis is bronchiectasis, having a sputum port at the bedside. Then you come back to the close to the patients and start the other procedures. But immediately after that, you come back from here and you found the symmetry, then you need to look like this, AP diameter is increased or not. You need to make the patient like this, sir, could you please do like this for me? So then you can see the AP diameter. So AP diameter is increased, diagnosis COPD and bronchiectasis. It's not the pulmonary fibrosis. Keep them in your mind, then do all the steps of examination skills, my dear. Yes, my dear doctor, that now the examination starts from the hands, my dear. We need to look at the hands first. So the starting from the hands. Sir, could you please do like this for me? Yes. You need to look and you need to hold these fingers all together like this, the tips of the fingers that you need to look for to see the cyanosis. So you need to hold the hands like the way so that you can compare with your own hands color to see the tips of the fingers, whether this is bluish color or not. So this is absolutely normal. So that you can see the tips of the fingers having cyanosis or not. So immediately after that means whenever you start your examination of the hands, then you need to see the clubbing, my dear. So you need to hold it here, you need to get down like this. So you need to see the way the clubbing, my dear. And then immediately after the clubbing, then you need to look for the here and there, the nicotinic staining, or you can say the tar staining. Somebody says that the tar staining, saying the tar staining rather than nicotinic staining is more appropriate. So yes, my dear. So clubbing, nicotinic staining, that we have seen the cyanosis. So the cyanosis done, the clubbing, nicotinic staining. Immediately after the clubbing and nicotinic staining, Mind you, listen very carefully. We call it the cancer bundle pack. So the clubbing, nicotinic staining, the wash that you need to see. Wash means wasting of the small muscles of the hands. Yes, my dear doctor, wasting of the small muscles of the hands means that you need to see the guttering here, guttering here, the guttering here. To see the guttering. He is not having the wasting of the small muscles of the hands. And the most important wasting that you need to see these muscles especially. These muscles is wasted, so you will see a big groove here. So the wasting is a pathognomonic features here. So yes, my dear, clubbing, nicotinic staining, wash. Just say with me, clubbing, nicotinic staining, wash. Immediately after that, clubbing, nicotinic staining, wash, these are, we call the cancer bundle pack. So once again, clubbing, nicotinic staining, wash. Then you need to go up to see the face and the neck and the chest for the cancer bundle packs. So immediately after the clubbing, nicotinic staining, wash, then you need to see the three important features here. We need to look for the Horner's, means the partial ptosis, at least Horner's syndrome, then the SBCO in the neck, and the lymphadenopathy. So once again, Horner's, SBCO, lymphadenopathy, and on the chest, the radiation burn tattoos. The tattoo marks, chest is the radiation burn tattoos, and maybe the radiation burn marks. Radiation means the radiotherapy tattoo marks and radiation burn marks. So what I said, the important points, my dear, starting from the hands, that is start from the hands, that you need to remember. Yes, you need to remember all together, so that I am showing here, so that you can remember all the 6 important bundle packs. So yes, the clubbing, nicotinic staining, wash. Once again, clubbing, nicotinic staining, wash. And then the Horner syndrome, SBCO, lymphadenopathy, and the radiation tattoo and radiation burn marks. Radiotherapy tattoos and radiation burn marks. Clubbing, nicotinic staining, wash. Horner syndrome, SBCO, lymphadenopathy, radiotherapy tattoo, and radiation burn marks. So the 3, 3, 6, and here is the 2 on the middle of the chest that you need to look for. So these are the 8 features of the cancer bundle pack that you need to look for. So immediately after that, the clubbing, nicotinic staining, wash that you have seen, just keep in your mind all the cancer bundle pack there. Just keep them all in your mind. But immediately after the clubbing, nicotinic staining, wash that you examine in the sinus is here, you need to tell him, sir, could you please turn your hands like this? Yes, you need to compare with your own hands to see is there any palmar erythema, and the warm hands, the way that I'm saying, the warm hands, the palmar erythema, warm hands, and the bounding pulses. So what I said, palmar erythema like this, warm hands, and the bounding pulses, and the flaps. So sir, could you please just spread your fingers and cock up your wrist back, and to hold it here and just give a pressure so that you can see the flaps. So once again, what I said, the palmar erythema, warm hands, bounding pulses, and the flaps, these are the 4 important features of carbon dioxide retention that you need to look for. So once again, sir, could you please show me hands like this to compare with own hands for the palmar erythema, then the warm hands, the way that you need to feel, and then take the pulse. And feel the pulse for the bounding pulses, and you need to count here for 15 seconds. And wait for the 15 seconds to see the respiratory rate. So immediately after that, the palmar erythema and the warm hands that you have seen, that the bounding pulses that you need to look for, you need to feel the pulse, and also you need to count the 15 seconds and count the respiratory rate altogether. Now count the 15 seconds, my dear. So yes, the 15 seconds is finished. So yes, you have seen that he has got the 4. So 4 into 4, the 16 breaths per minute. Or 16 to 18, 18 to 20. So it's enough. So yes, my dear. Immediately after the things that you have seen, that the respiratory rate, my dear, this is must in your respiratory examination. You need to tell him, sir, spread your fingers, spread the fingers, spread. And cock up your wrist back, cock up. Cock up your wrist back, like this. And to hold like this here, and hold like this here. So you need to hold your hands and just put the hands back to see the flaps. So yes, my dear doctor, listen very carefully, that the things that you have already done, the carbon dioxide retention, there's a power rhythm of warm hands, burning pulses, and the flaps, these are features for carbon dioxide retention. So you need to get the findings in your hands so that you can say the carbon dioxide retention features is there, the respiratory failure is there. You need to confirm it by doing the bedside ABG. Just keep in your mind this line. We'll do it at the end of the examinations and we'll say to our examiners. So immediately after that, my dear, listen very carefully. You finish your hands examinations and then you go up and you look onto the face. Very simply, just tell him, sir, could you please look up for me to look for anemia, and can you look down for me for the jaundice, and once again just stick your tongue out for me. So anemia, now up, tongue up, and show me your gum for the gum hyperplasia. So no anemia, no jaundice, no gum hyperplasia. So you need to just have a look onto the face. So immediately after the face, that you need to see the trachea, my dear. And keep in your mind the trachea is always central, until otherwise the things that we already learned in the approach session. So yes, my dear, you need to put the hands like this and to tell him, sir, I'd like to feel the windpipe. Just feel it and just put the middle finger in between the sternocleidomastoid, you see, in between here and in between here, just to feel whether this trachea is really divided to any parts, just to feel the space. That's it. And sometimes this is the trachea and the cricosterna. So there's 3 fingers. This is a cricosternal distance. So these are 3 finger breaths. And sometimes this is reduced in case of COPD. So you can do it or you cannot do, not necessarily that you need to do. So now, my dear, the chest profile examinations. Of course, starting with the inspection. Inspection needs any of the scar mark and the shape of the chest that you need to see. And sometimes the chest deformities like the pectus cavatum, pectus excavatum, carinatum, and also on the back that you need to see any kyphoscoliosis, any deformities that are present or not. So now you need to remember, my dear, the important points that the CE, PN, BSBR. What I said, CE for the chest expansion, PN for the percussion note, BS for the breath sound, and BR for the vocal resonance. Yes, my dear, we skip the tactile vocal frametas with the TVF, because the TVF and vocal resonance are the similar representations. So yes, my dear doctor, just say with me, CE, PN, BSBR. Once again, CE, PN, BSBR, CE, PN, BSBR, CE, PN, BSBR. So once again, CE, PN, BSBR. What is this? This chest expansion, percussion note, breath sound, and vocal resonances. So these are the important things you need to do onto the front and the back of the chest altogether. So you need to put the chest, hands over the apical zone here. And you need to put, like these are good pressures that you need to do. And you need to tell him, sir, could you please turn your head on the left side for me? And now take a deep breath in and out for me. Once again. So see, the chest expansion, yes, it's a good chest expansion. Yes. So this is the apical zone. Next, at the nipple level that you need to hold like this and take a deep breath in and out. So you need to give a good pressure here. So once again. So this is definitely the chest expansion, like the more than 2.5 centimeters is normal. And now in the basal zones, you need to put your hands like this, take a deep breath in. See? So this is normal. Once again. So yes. So typically, so you need to see the apical zone, the mid zone, and the basal zone all together. So these are the chest expansion is normal on the both sides. But we are looking for, definitely this is less than that of These that we can see in the different cases, in the video clips, in the different cases in the respiratory system. Immediately after the CE for the chest expansion, the P and BSB are the percussion note, my dear. You need to put your hands like this and you need to tell him, sir, I'd like to tap on your chest. You need to percuss. So you see the resonant sound. And then over the clavicle, And to put your hands like this. So liver dullness and cardiac dullness. And also you need to put your hands here. And also here, over the axilla. The 3 places in the axilla is enough. So you need to compare on the both sides for the percussion note. Immediately after the CEPN, then the BS for the breath sound. You need to take the stethoscope and you need to tell him, sir, take a deep breath in and out. And you need to, with the bell over the apex, take a deep breath in and out. Once again, sir. Now with the diaphragm, take a deep breath in and out. Once again. 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 So yes, my dear doctor, this is about the breath sound. Is normal. Immediately after the CP and BS, the BR for the vocal resonances, you need to put the stethoscope to the similar places and you need to tell him, sir, could you please tell me 99 for me?
99.
So once again.
99.
Once again.
99.
With the diaphragm once again.
99.
Once again.
99. 99. 99. 99. 99. 99. 99. 99.
Thank you. Thank you very much, sir. So this is all about the CEP and BSVR. So one of the important tips and tricks, my dear, listen very carefully. If you're feeling that the pathology on the apical zones, so you need to be very vigilant and you need to spend quite a bit more time onto the front of the chest to get the findings in your hands. Means the apical zone is the front chest. So front chest is the apical zone. Apical zone is the front chest. In contrast, basal zones onto the back. So basal zones back, apical zones front. What I say means whenever you're expecting the findings onto the apical zones, please be vigilant onto the anterior aspect of the chest whenever you are examining. Whenever you are thinking and you are considering your diagnosis on the base of the lungs, so the base and back means the back of the examination means the back that you need to be very vigilant to examine onto the back. So yes, my dear doctor, immediately after the front chest, you examine him. You need to tell him, sir, could you please do like this for me? Do like this? Yes. You need to tell him, do like this for me. And immediately after that, you need to examine the back. As I said, the tips and tricks, my dear. The back means the basal zone. Back means basal zone. The pathology is there. So you need to spend more time onto the back rather than the anterior chest. Whenever you feel that, the findings will be on the back side. Is the basal zones. So now, same things that we need to do like the CEP and BSVR. So the chest expansion. So here the chest expansion we already have done for the apical zones. So you need to do the mid zones here. You need to tell him, take a deep breath in and out for me, sir. Yes, very good. Once again. So see, this is the normal chest expansion. So once again, you need to do like this, the basal zones. Take a deep breath in. Once again. So this is about the chest expansion. And next, the percussion node miter. This is the scapular border. This is the scapular border. So now we need to put the hands for the percussion. And you need to tell him, sir, I'd like to percuss and tap on your chest. So this is the percussion, but if you missed to examine the axilla, means the lateral border. So you need to do the axillary part as well. So yes, this is axillary percussion. So immediately after the CPN, then the BS for the breath sound. So you need to put the stethoscope here for the breath sound to tell him, so take a deep breath in and out all the way through your mouth. Once again, 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 over the axilla as well. Once again, once again, once again, once again, once again. So this is all about the breath sound. Immediately after the breath sound, with the CPN, BS, VR for the vocal resonance, you need to put the stethoscope and you need to tell him, sir, could you please say 99 for me?
99.
Once again.
99.
Once again.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Thank you very much, sir. So immediately after the CPN BSVR, so you finished, my dear. Now, if you found any of the crackles, this is important. So you need to quantify the crackles, my dear. Before quantify, I'll show you how quantification should be done. But before you need to know that the crackles can be the fine and the coarse. So the fine, coarse, fine and inspiratory, coarse toward the inspiration and maybe the expiration altogether. So fine and inspiratory crackles, or coarse toward the inspiration or expiratory crackles. And the fine and inspiratory crackles that don't change after coughing, means having a cough before and after, if no changes, so this is the pulmonary fibrosis. In contrast, the coarse toward the inspiration and expiratory crackles that changes after coughing, essentially that diminished after coughing. So this is bronchiectasis. So the differences in between the pulmonary fibrosis and the bronchiectasis should be done fine and inspiratory crackles that don't change after coughing. Coarse inspiratory toward the inspiration, expiratory crackles that changes or essentially reduced or maybe absent or diminished after coughing. So this is the differences in between the pulmonary fibrosis and bronchiectasis that you need to do if you found the crackles, the added sound. So you need to put the stethoscope here and you need to tell him, take a deep breath in and out. So now give a cough for me. Once again, take a deep breath in and out for me. Once again. Once again. Thank you, sir. Thank you very much. Immediately after you finished, my dear, the back examination of the chest, then you need to see the back of the sacrum as well to see the sacral edema. And also you need to put the hands over the anterior chain and the posterior chain, the supraclavicular chain for the lymph glands. So no lymphadenopathy. So immediately after the lymph nodes that you finished examining, then you need to tell him to lie back to see the leg edema. So immediately after the lymph glands that you examined, my dear, and then you need to see the legs, my dear. You need to tell him, sir, I'd like to see the legs. And you need to tell him, sir, do you have any pain at your legs right at this moment?
No.
All right. So you need to put your hands here and look at the face. So he has no edema, my dear. So yes, my dear, this you need to give the clothes back the way that I'm doing, my dear. And then you need to come back here. And whenever you felt finished, then you can see any of the surroundings, bedside surroundings once again to check once again for the nebulizers, any nebulizers, or maybe any inhalers. So inhalers, nebulizers, any oxygen cylinder at the bedside, and also any peak flow meter, and also any sputum pot at the bedside, and also to look for any of the walking aids at the bedside. So surroundings will be really helpful. so that you can understand the patient's current treatment or any current treatment, like the steroid evidences at the bedside, and also the steroid stigmata that you need to look for. Yes, my dear. So if you finish that, you felt finished, then you need to tell him, sir, thank you very much. You have done really excellent. And you need to give him the clothes back to him. Yes, my dear doctor, whenever you felt finished and you give a good thanks to him, sir, you have done really excellent for me, and thank you very much. Handshake with him and wash your hands at the end of that. And whenever you feel that you finished, my dear, then you come forward to the examiners. Look at the both of the examiners, eyes to eyes, and having a good confident posture, and take the stethoscope in your hands, my dear, and start your saying. Sir, I'd like to finish my respiratory system examination to do the bedside spirometry and bedside arterial blood gas analysis, and also to do the cardiovascular system examination to exclude the features of core pulmonary. And also, sir, I'd like to check the observation chart that includes that the pulse, temperature, respiratory rate, blood pressure, and oxygen saturation. Sir, I'd like to do the urine dipstick for the sugar, protein, RBC nitrites. Saying these three important bundle packs mean that you finished your examinations and will get the satisfactory marks in the examination section. Otherwise, you will not be able to get the satisfaction marks, even though you have done really excellent in your examination methods. And now the important tips and tricks, my dear, listen very carefully. Immediately after the examinations, that you need to formulate your findings, your approach, your saying the presentations to the examiners. You need to formulate in your hands. Whenever you finish your examination, you wash your hands and you give the clothes back. And during these 30 seconds at least, that you need to think about that what ways that you are presenting, my dear. What are the most important top tips and the tips and tricks, my dear? We call it the SS tips. Of course, the SS tips is whenever you are really confident in your diagnosis, that you start with the diagnosis first, then go for the evidence-based some of the clinical findings. Or if you are confused, having some of the plus minus, you are not really confident, then you start with the slowly with the science, and then say that my differential diagnosis. So the two categories of the presentations that you can do. But the way is not always that you can fix that I'll do this. No, my dear. I'm saying, my dear, if you're really confident on the findings, you start with the presentation first, means the diagnosis first, followed by the clinical findings. This is called a retrograde presentation. And anti-grade presentation is that if you find some of the findings, if you're really confused, then start the findings and put together saying that my most likely differential diagnosis is one, second, third, fourth differential diagnosis. Yes, my dear, this is the important tips and tricks. But my dear, listen very carefully, because you are really confident. The most of the cases that you are going through this course, my dear, you'll have really a good confidence so that you can start the presentation the way that I say it, my dear. Keeping the important points in your mind that you need to present your case. And you'll see in the different cases that how the things can be done and how to present your cases, my dear. Keeping the 7 important points altogether, as I already said. As I already said, the 7 important points, the recap, once again, the chronic lung disease evidenced by cyanosis. Second type of the lung disease, the clubbing. And then third important point, that the lung disease is complicated by the respiratory failure, carbon dioxide retention. And then the respiratory cardiac failure, means the core pulmonary, the features. And fifth important point, is in corticosteroid or not. And then you need to look for the underlying etiology of the disease. And last, any treatment, any options, means any bedside surroundings, so that you can say this gentleman is on this treatment. So these are the 7 important points that you need to remember so that you can be able to get the full marks in 20 out of 20. I hope and believe, my dear, after seeing the further cases, you'll be able to be a good competent doctor, my dear, as well as a good competent candidate for the PACES exam. I hope that, my dear, you enjoyed. Thank you very much. Thank you once again.